problem with most of the cardiology patients are the patients of stable coronary artery disease. And these patients almost have exertional angina for a couple of months, maybe years, and they are on various drugs. So there are debates whether which drug is useful, which is not, and what is the role of angiography and angioplasty later on. The main concern is the use of drugs and how long it has to be used. All these patients most of them are young, less than 50 years of age, and initially they are on nitrates, whether you start with a short-acting nitrates or long-acting nitrates. The short-acting nitrates we usually give in acute episodes, but patients who has a stable coronary artery disease have mostly on the long-acting nitrates. The only problem with the nitrates is, the drug resistance and headache. So we can add, along with the nitrates, we can add the beta blockers, preferably a metoprolol. But unlike metoprolol, there are others, second line of drugs like ivabradine, ranolazine, and trimetazidine. And once these drugs does not work, then all these patients should be thoroughly investigated and sent for some further stress thallium or invasive measurements like coronary angiography, and to look for severity of the coronary artery disease. So, and then comes the role of statin, especially the high dose of statins, either rosuvastatin or atorvastatin, and then the role of antiplatelet in such situation. The initial we used to give clopidogrel 75 milligram once a day, but then newer generations antiplatelets like prasugrelol and ticagrelol, they are all also being used. So antiplatelets have a very useful role in prevention of plaque rupture, and it helps in improving the plaque stabilizations and reduction in the endothelial dysfunctions. Thank you so much.